Hi, I'm Tina Dale with the Fairfax County Health Department, and today we are broadcasting live from West Springfield High School. As many of you are aware, vaping has been in the news quite a bit lately, and the Centers for Disease Control and Prevention just released last week that it is now investigating nearly 1,900 lung injuries associated with vaping and now up to 39 deaths. Just last month, our Doctor of Epidemiology and Population Health, Dr. Benjamin Schwartz, did a Facebook Live video to discuss the lung injuries associated with vaping. However, today, the Fairfax County Health Department and the Fairfax County Public Schools are focusing more on how vaping is an issue in our school system, but what we can do to help our students stay vape-free. So joining me today to discuss this, I have Bharat Kalra. He is a sophomore at Marshall High School. We have Marty Joyner. Marty is our substance abuse prevention specialist with Fairfax County Public Schools. In addition, Christy Vitter. Christy is a school public health nurse and a member of the school health promotion team. So before we jump into the meat of our conversation, I'll ask both Marty and Christy to step aside and allow Bharat and I to have a conversation, because this is really a big deal, vaping among school students. So from your experience as a student, as a high school student, how prevalent is vaping in what you're seeing among students?
Well, I actually think that vaping is really prevalent among students. Mostly, it's happening through bathrooms. It's happening in parking lots. It's happening mostly after school and places where administrators and teachers cannot see the students, and it's mostly happening in those kind of places.
So do you see that, is there a stigma associated with vaping among students? Are you seeing anything like that?
Well, I think more than just a stigma, I look at it as sort of a puzzle. And every kid is trying to fit in their own puzzle piece. So all the kids that are vaping or are involved in some sort of substance abuse, they're mostly just trying to fit in their own puzzle piece. So more than just looking cool, they're mostly doing it just to fit in. A lot of these kids are struggling with mental health issues. They're struggling with depression. Not all of them, but a lot of them are struggling with a lot of other issues, and they're using it to alleviate some of that stress.
Which is one of the topics that we discussed last month, stress. So obviously we understand that a lot of students suffer from stress, and vaping, some students might be looking at that as one of the ways to alleviate. Yes, we are definitely seeing that. What is the attitude surrounding vaping?
I think kids are not realizing that vaping is actually dangerous in a way. They're not realizing that vaping, they're not realizing the nicotine content that is in vaping. Actually, one Juul pod has the nicotine content equivalent to about 20 cigarettes.
Wow.
And that's something that I don't think a lot of kids are aware about. So I think it's really important that parents know that this is just more than vaping is playing with kids' lives. You're playing with kids' lives at a point here. You're putting lives at stake.
Okay.
It's a really huge problem.
Yes. Well, thank you, Bharat, for sharing. I'm going to invite you back in to discuss with us a little bit more later on. But Christy, go ahead and hop in here, and let's kind of get down to the meat of things. Thank you very much for being with us, Christy. So what are some of the biggest concerns that we're seeing right now in terms of vaping and its impact on students' health?
Absolutely. I think our biggest concern right now is just how much we don't know. This is a relatively new product, a relatively new phenomenon, and we are just starting to discover all of the dangerous and harmful effects of these products. So in effect, our current users are the guinea pigs for the industry. What we do know is that these products contain a number of chemicals, one of which is nicotine. Nicotine, of course, being the highly addictive substance that comes from tobacco that we see in cigarettes, cigars, things like that. We also know that human brain development doesn't finish until the age of 25 or 26. And during those development stages, the neuropathways are actually changing and developing. And when they're exposed to highly addictive substances like nicotine, it actually changes the basic fundamental chemistry of the brain and changes how we react to addiction, addictive substances in the future. So it really is important that we are avoiding these substances wherever possible. In fact, we know that if you don't start using these products before you're an adult, you're much less likely to use them once you are an adult. The industry also knows this, which is why they market so heavily to children and teenagers.
Wow, that's pretty scary. So, Christy, you talk about the nicotine and the what's happening in the child's brain pathways, but you also mentioned chemicals. What kind of chemicals are we talking about?
So right now there are over 65 chemicals in these products that we are aware of. Some of them include formaldehyde, which is what we use to embalm dead bodies. There's acrolein, which is an herbicide. There's benzene, which is a VOC, or volatile organic compound, which is what's in car exhaust. There's diacetyl, which is the chemical linked to a phenomenon called popcorn lung. There are also over 7,000 chemical flavorings that are used in these products. These chemicals are considered safe for human consumption, for eating, but they are not considered safe for inhalation.
So one of the things that we had talked about earlier, it's the actual act of vaping, and so what's happening with the vape, it's aerosolized. Can you talk a little bit about that?
So a lot of people think that these products are just water vapor. They're harmless, chemicals, flavorings, things like that. But they are these chemicals, and they do create an aerosol, which is then inhaled into the lungs and does significant damage to the lung tissue.
Okay. What is the school health promotion team doing to help students understand the effects of vaping?
Obviously, this is a very important issue for us right now in the health promotion team. We are doing presentations to a number of different groups, to staff, to students, to parents, to the PTA groups. We're going out into the community, things like resource fairs, STEM fairs, STEAM fairs, Celebrate Fairfax. We're also launching an initiative for the months of November and December where we are going to be talking to kids in the schools. You may see some of this coming home. For our elementary students, we are focusing on a message that lungs are meant for air. And then for middle and high school students, we're talking about your breath matters, your choices matter.
That's great. So lastly, if there is one thing that you really want parents to remember with all this information that you've provided, what is that one takeaway?
The one takeaway is really that vaping is not safe. These products are not safer cigarettes. There is so much that we don't know, and unfortunately, current users are the guinea pigs, and much of what we're learning about these products is because people are having illnesses and injuries related to them.
Thank you, Christy. That's great information. I'm just going to ask you to step aside, and I'll invite Marty right on in. So we heard from Christy some of the impacts that's happening to our students' brains and bodies from vaping. But this is an issue that is for our students kind of throughout the school system. So what can you tell us about youth in general and its impact, but more specifically to Fairfax County?
Well, the Fairfax County Youth Survey tracks this information. The students take this survey every October. And in October of 2018, which was a year ago at this point, there were 28% of students who had at least tried e-cigarettes. And for seniors, that was up to 39%.
Wow.
Okay, so it was pretty high. We actually expect that it could be a little bit higher, hopefully leveling off this year, but sometimes the data is delayed. Okay. The other issue we run into is that kids are addicted to nicotine, much the way smokers were for a long time, and we've really gotten smoking down to below 5%, and unfortunately e-cigarette use is now coming in and taking the place of that. And then also it's leading to a lot of THC oil use, which is the modern day version of marijuana. With our neighboring states having different laws, in the state of Virginia, it's very accessible for kids to go to people who are of age who can get these materials and be able to use those items. So it is causing some unintended consequences as well.
So why is it so easy for kids to start vaping?
Well, I think the easiest thing is because it's considered safe, as Christy said. It's one of those things where they do believe that it's safe. It's also fun because they use fruity flavors. The flavor of mango was the most popular Juul flavor that was out there, along with creme brulee and a few other things. So they're very popular with the students as far as that goes. They also are easy to hide. Okay, sometimes you'll be used to seeing the larger e-cigarettes or vape devices that people carry around, but that's not what students are using. Students are using items that are intended to hide, with Juul being the most popular one. I think we have some pictures for you, and you probably haven't even noticed that I've been holding a Juul in my hand the entire time. Okay, and right here you can see that I can easily conceal it. You wouldn't even know that I had it.
I understand that new laws went into effect on July 1. Can you talk about that?
Well, July 1st, everything went up to 21. Okay, and that was tobacco and nicotine products across the board in the state of Virginia, and that's been a great thing. One of the issues that we had was that we had students who were of age who could actually get these things legally. So at least we now know that everybody in school is not able to get this information or these items. Also across the board, we've seen that states and the federal government have started to react to the fruity flavors, and everybody recognizes that they really were marketed to teens.
Mm-hmm. So what is Fairfax County Public Schools doing to help teens understand the laws and the implications of vaping?
Well, Fairfax County Public Schools has just reinstituted the substance abuse prevention specialists, and we're now school-based, and we cover the entire school pyramid, so we can help students who do have an addiction to nicotine as well as other substance issues. We also go around, much as the health department does, and we do presentations for PTA groups, staff groups, and go into student classes to further educate them.
Fantastic. So at this point, I would like to invite Bharat and Christy back so we can wrap up our conversation here. Christy, if a parent suspects that their child might be vaping, what are some of the signs that they can look out for?
Sure. So one of the biggest giveaways with these products is that they do have a very strong scent. It is a very fruity, very pleasant scent. In terms of physical symptoms, what we see is kids start to have more and more nosebleeds. They have an unexplained cough or mouth sores that won't go away. We also fairly frequently see that kids will have acne around their nose and mouth, just that area. And then interestingly enough, Tina, one of the things that we're seeing is that these products cause a sensitivity to caffeine. So kids who previously had a lot of caffeine, drank their coffee every morning, all of a sudden can't tolerate it at all.
That is fascinating. So, Bharat, you've heard what Christy had to share here. From a teen perspective, what would be some good questions that parents could ask their kids?
Well, I think the most important thing that parents could ask, I think is just they should be having a heart-to-heart with their kids. This could be at any age. If you haven't had a heart-to-heart talk with your kids about the dangers of vaping, the facts surrounding it, why it's dangerous, maybe some shock therapy at the same time, giving them articles of kids who have even died from this, from these kind of dangerous behaviors. So I think it's more that more than just parents asking their questions to their kids. It's about asking them who they're hanging out with, what they're doing in their free time, making sure, having tabs on them, and not to the point where it's suffocating them, giving them their space at the same time, but at the same time also making sure that they're doing the right thing, making right choices.
Do you have any suggestions for parents that they could say to their kids to help discourage them from even trying vaping?
Well, I think, again, as I mentioned before, shock therapy is the most important thing. I think when kids actually find out the facts surrounding it, they are able to see why it's so dangerous, what makes it so dangerous. I think that's the most important part that kids need to know, just spreading the word out there.
Excellent. Marty, where can parents turn to?
Well, they can take a look at the Fairfax County website and search for the Student Safety and Wellness Office on the Fairfax County Public Schools website. Also, fcps.edu/vaping has some good information. And I think what's important to keep in mind is that this information is constantly changing. What we tell you today could be very different even a month from now. Okay, so it's important to be a student of this information and make sure you're always keeping up to date with the current trends.
Yes, absolutely. So some great information. Thank you all for joining us here today. If you would like to get more information on vaping, just as a reminder, some of the resources that Marty shared, go to fcps.edu/vaping, or you can also go to fcps.edu and search we can student safety and wellness. Now, for information on the quit line for any type of vaping or smoking products, you can go to 1-800-QUIT-NOW. Resources are also available on the smokefree.gov website. For information about the Community Services Board, go to fairfaxcounty.gov and search Community Services Board. And then lastly, if you would like to get more information about the School Health Promotion Program, go to fairfaxcounty.gov/health and search for School Health. Again, thank you to all of you folks for joining me here today. A special shout out to West Springfield High School for hosting us today. And we hope that to see you all again soon. Thank you so much for joining us.